warmer, warmer weather Wednesday. Thankfully to have some temperatures that hopefully will be above 70 today. I am Bridget Lucky. I am the chair for this health equity work group. And again, so grateful that you all could join us just to be with us and help us navigate this process of health equity and to help us meet our metrics in the CDC application that we were approved for. I am going to share my screen. Donna, will you allow me to share my screen?
Yes, you should have privileges now.
Perfect, thank you. All right. So today, here's our agenda. We'll do our welcome, our introductions. I'll introduce the guest speaker, and so grateful that Dr. Cherry Beasley is with us today. We'll then open it up for Q&A and general discussions, and then we'll have our next steps, and hopefully we'll adjourn around 10:30, and you all can continue your day. Our objectives for this meeting is to, of course, introduce the health equity work group purpose, to have the Robeson County presentation and discussion, and also group updates. And so now, as Donald said, we have some new faces to our group, and we're always excited to see the fabric of our state displayed in this group. What we're going to ask you to do is just to give your name, your organization, the region of the state you are from, and just kind of our wellness check-in. How are you doing today? And I'll kick it off, and we'll do a popcorn style, if that's okay. So as I said, I'm Bridget Lucky. I am the director for Vidant Community Hospital Grants and Outreach. We cover the eastern part of the state, about 33 county radius. And today I am doing okay. Glad to see some great faces that are committed to this work in equity. And I will pass it to Kimberly McNeil.
Good morning, everyone. I'm Kim McNeil. I'm with the Office of Rural Health. Of course, we cover all of the state of North Carolina, but my focus is on regions 4 and 6, which is the east region of the state. I am doing pretty good today. It's been a long couple of weeks. We've been very busy, but I'm doing pretty good. Nice to see some sunshine today. I'm going to pass it to, let's see, is that Randy Jordan? Pass it to Randy.
Yeah, thanks, Kimberly. I'm Randy Jordan with the North Carolina Association of Free and Charitable Clinics. And we're a statewide organization and have a presence in 88 of North Carolina's 100 counties. Our purpose is to take care of the uninsured from a health and social service perspective. I just returned from a 4-day trip to Florida to visit my mother and my mother-in-law. And it's so nice. I agree, Bridget, that it's nice to see the weather of Florida now in North Carolina. And I would turn to Philip.
All right, peace and blessings, everybody. My name is Philip Cooper. I like to go by the name Change Agent Cooper. As far as what organization I represent, man, I wear many hats. Full-time right now, I'm leading a project called Inspire Recovery Careers. It's funded by the Appalachian Regional Commission, and it's at the Land of Sky Regional Council. But I'm also a co-leader of Voices of Afro-Latia, which is a state-funded initiative, and we're working on ending the mental health stigma in the Black communities of Western North Carolina, West Side. How am I doing today? I'm lit because I'm going to be in Charlotte later, and I'm going to be there today and tomorrow. And I always get excited to be around some of those folks in Charlotte because they're doing some really good work. My man, Kenny Robinson, I'm so excited to see him today. So yeah, man, I'm doing great and optimistic. And I'm going to popcorn it over to Shaughnessy Lofton.
Good morning, everyone. I am Shaughnessy Lofton, and I am from the Greensboro area, AHEC. And so I am supporting the Region 2 of the state, and I'm doing great. I'm glad to have Philip here. He's amazing, and I think I passed his information to our leaders of this group because I believe that he brings a great skill set that we might need on this work group. I will pass it to Juan Allen.
Good morning, everybody. My name is Juan Allen. Is community coordinator for Farm Workers Unit in an insurance program for accesses. I'm doing great. Having problems with my computer as usual. Sorry that I was late, but I'm doing fine. I pass it to, I don't know who's next, actually.
I'll jump in. Good morning, everyone. I'm Donald Hughes. I'm with the Foundation for Health Leadership and Innovation. I'm a Director of Community Voice. We are excited to have all of you all join us today. We represent or work in communities across the state. And I will say I was a little tired. I have like severe pollen allergies, but Philip, man, you just kind of boosted my spirits. So I appreciate the energy that you're bringing to the work group. And I look forward to connecting with you and learning more about your work. I will turn it over to Neil.
Thank you, Donald. Good morning. I'm new to the group. My name is Neil Gurney. I'm the president of Gateway Wellness Foundation. We're headquartered in Marion in McDowell County, but we operate McDowell, Polk, Burke, and Rutherford counties. We're a grant-making foundation across those areas, but the biggest piece of what we do is affordable housing. We got a big development in Rutherford and a very big one planned in McDowell at this stage of the game. And I'm doing exceptionally well. We're looking at some new land this afternoon. I'm hoping that it'll pan out for us to do another piece of work. And I will pass it on to Cherry. Sorry.
Good morning, I'm Cherry Beasley. I am doing great this morning, actually, except having also a little trouble with allergies, but I accept that, getting to live in beautiful Eastern North Carolina. I'm a native of Robinson County and a member of the Lumbee tribe. And I also happen to be your guest speaker this morning, or not really speaker, but hopefully facilitator of your discussions.
Robin, do you want to jump in?
Yes. Good morning, everyone. I am Robin Simon. I am with Appalachian Healthcare Training and Consulting. I live in Watauga County, which is where Boone is, and my focus is really on improving health equity, health disparities in the Western and Northwest regions of the state. And I just wanted to, well, let's see how I'm doing today. I'm doing really good. It's supposed to be 70 degrees here. So I'm hoping to enjoy that in sunshine and get ready for the snow we're getting Friday and Saturday. And also wanted to give a shout out to Philip, Change Agent Cooper. We have not actually met, but we are both fellows in the Appalachian Leadership Institute. So I'm glad to see you here. And let's see. I believe, Donna, have you gone?
Well, good morning, everybody. My name is Dania Simmons, and I am over here in the East. I work with Downey's Partnership for Children. I am the Ready Community Specialist, and our focus is to make sure that children have the opportunity to be healthy, lifelong learners by the age of 3rd grade. And I am currently a Bernstein Fellows working with Ms. Carla and Donald and Bridget on my next project for this year. So thank you so much today. I feel fantastic, and I'm energized to be amongst great leaders.
Thank you, Dania. Donna, do you want to go next?
Sure. Good morning. I'm Donna Good Ledbetter. I am from McDowell County in Marion, where Neil's Foundation is located. I am the Director of Equity for West Marion Community Forum, and I serve on the Dogwood Health Trust Board of Directors and a lot of other stuff. It's a lot of familiar faces on here, especially Philip. He gets everybody hyped. So I'm just excited to be amongst you folks and maybe make some new connections to further the work to change the policies, practices, and procedures in all of these systems that are not equitable. And I will pass it to Shannon.
Hey, Donna, thanks. It's good to see you here. I'm Shannon Moritz, Director of Strategic Initiatives with Compassion Healthcare. We have 2 federally qualified community health centers, one in Tazewell County and one in Rockingham County. And so I'm in the northern Piedmont. And I'm on roller skates today. I'm excited because I'm finally going back to the office for the majority of the time, which is super exciting. And I am frustrated because my phone and my computer have decided to eat half of my emails and half of my voicemails and everything else. So if I owed you anything and I haven't heard from you, you haven't heard from me, I am sorry. Please ping me again. Looking forward to today.
Thanks, Shannon. And we'll hop over to Sarah. We have a lot of Western North Carolina representation today, which is awesome.
Good morning. I'm sorry I don't have my camera on. I'm really excited about all the folks from Western North Carolina. My name is Sarah Copley. I'm with WNC Bridge Foundation. We serve the 18 westernmost counties of the state from Burke over to Cherokee. I'm doing well today. I really look forward to this meeting. I always learn something new that I can apply to my work here and working with grantees. So I'm really excited for our speaker. Yair?
Yeah, thank you. I'm sorry about not being able to be on camera. I'm in transit at the moment, but hello everyone. My name is Yair Castellanos. I am community cultivator with ABC2. We work out of the northeastern part of North Carolina, focusing around community health and different things like that. I am doing well today. A little tired. I had to get up early, but glad to be here. And I'm not sure who else hasn't gone, so I'll pass it over to one of the facilitators. Maybe they could help me out.
Kayla and Kashida. You are the last 2.
Good morning, everybody. My name is Kayla Taylor. I am the Community Outreach Coordinator for Baton North Hospital and the Roanoke Valley Community Health Initiative. I serve Halifax and Northampton County, and I'm doing just fine today. Glad it's finally getting some warm weather around here.
Good morning, everyone. My name is Kashida Jackson. I also work with Biden Health. I have the privilege to work as the Vice President of Health Equity Social Impact. I am in the eastern part of the state, and I am doing marvelous this morning. Looking forward to my son playing baseball today.
Did everyone have an opportunity to introduce themselves? All right, great. I think we got everyone. So I am going to pull up my other information to be able to share with you. So we are very fortunate to be able to have Dr. Cherry Beasley here with us. Thank you so much again for taking time out of your busy schedule to just let us know what's going on in Robeson County. I'm going to share some information about Dr. Beasley, and please feel free to add Dr. Beasley if I do not capture everything in your amazing bio. Dr. Beasley has devoted her professional nursing career as a nursing provider, educator, and a researcher. She began carving her professional path as a student at Red Springs High School. She spent a lot of time observing the care her grandmother received after she was diagnosed with cancer. The immediate relationship between the nurse and the client is what attracted a young Beasley to the field. She began reading and studying the various levels of patient care. The more she studied, the more she was assured she was on the right path. She received her nursing degree from the University of Michigan and landed her first job at the Santa Ana Psychiatric Center in California. Beasley went on to receive a master's in nursing and public health nursing from UNC Chapel Hill, a postmaster's family nursing practitioner from the University of South Carolina, and a PhD from East Carolina University. Dr. Beasley is the first Lumbee to have earned a bachelor's, a master's, and a doctorate of philosophy, all in nursing. Her areas of expertise are cultural roles in healthcare decision-making, rural health, diabetes, nursing workforce issues, and women's health. She has taught at North Carolina Central University, University of North Carolina at Chapel Hill, and the University of Tennessee Health Science Center. Dr. Beasley has written and administered many grants and is the author of numerous articles. Her research and practices have been focused on the lumpy health issues, including child development and breast cancer. She's a member and a leader in numerous nursing organizations, including the American Nursing Association, North Carolina Nurses Association, Sigma Theta Tau, the National League of Nursing, and Delta Omega. Beasley has a rich history of family members who graduated from UNC Pembroke, including her mother, who holds 2 degrees, her father, her stepmother, and her grandfather. Currently, Dr. Beasley is the interim dean of health of the College of Health Sciences, associate dean of the Mackenzie Elliott School of Nursing, and the chief nursing officer and endowed professor at the University of North Carolina at Pembroke. Dr. Beasley, thank you so much for joining us today, and please just share information as you wish.
Thank you. That was a little daunting, but thank you for that great introduction. I think the most important thing I want people to know about me and about my work is that I've had the privilege of looking through the lens of culture at health and what it means. So being reared in rural North Carolina and a very culturally diverse community, as we're going to discuss Robinson being, I had an opportunity to be enriched by culture. But then when I went to the University of Michigan to college, there was no cultural diversity in my class. So I'm old, I'm 70. And so I graduated from college in 1973. And so one of the issues at that time, and then you heard the opportunity to go to Santa Ana and work in a methadone clinic, detox clinic. And so I learned very quickly from my patients that culture really made a difference and that it was okay to embrace our cultural understanding of health and actually to cultural understanding not only what health is, but who the appropriate providers are for health. And so if you're going to allow me to share my screen, I'm just going to talk with you a little bit about Robeson County and then try to talk with you about some of the initiatives that I think this group may want to consider just by looking at what some of the things that we're doing here at UNC Pembroke. So may I share my screen, or is that an option?
You have the option to share your screen.
Okay, thank you. Of course, like everybody else is saying they're having computer problems this morning, it won't. Let me do it. It's not letting me see my screen.
The presentation for you, Dr. Beasley, if you like.
Yes, would you do that for me, please? Thank you. And I'll just have to tell you when. So I wanted to start out today with a picture of one of the spots in Robeson County that we, not only as Native people, but people of the area consider, to speak of who we are. So you see the ancientness of the Lumber River, the ancientness of our cypress trees, but yet also something that's often looked at as a simple river, a dark water river, and they say it's not clean, but it's actually one of the cleanest waters in the state. So to say something from the outside, one looks at why would people want to swim and play in this water, but it's extremely clean. It's also deceptive in that it's deep and has a lot of pitfalls. So sometimes I think we look at culture and healthcare as maybe just something picturesque, but then as we delve in it more, we look at the complexities of it. I also want to begin with a land acknowledgement statement. If you'll change the next slide for me, please. Okay. So if I look at the who we are as people, and one of the things that we do as a cultural group is begin by acknowledging who our ancestors were and actually how we need to move forward in with them. And so one of the things that I would like to do is say that we are going to begin today with respectively acknowledging that the lands within and surrounding present-day Robeson County are the historical homelands and gathering places of many indigenous people. One of the things that people often don't understand is that when the European nations had their periods of discovery and looking at who, well, conquering is actually the word I want to use here, is going out and looking at the lands. They had a principle called the Doctrine of Discovery. And in the Doctrine of Discovery, all European nations, it started with France, then quickly moved to England, Spain, Portugal, that if you discovered a land as a member of those countries, then you actually own the land. And so the land, whether it was in Africa, whether it was in India, whether it was in the Americas, then was actually owned by the state or country that discovered it. So one of the things we have to look at is that even though people were already living in those areas, the Doctrine of Discovery said that they had no ownership, they had no right to be there, and they moved forward within and with their conquering ideas. And I don't want to seem disparaging to what happened to my people, my friends who are members of the Caucasian race now, many of who didn't have anything to do with that. But I do think we have to put things in the historical context. Just as slavery damaged our African-American brothers and sisters, and our misunderstanding of Eastern ways have damaged our members of our community who are from Eastern thought. American Indians also have faced that, and with the Doctrine of Discovery. So I have put down some of the native lands here in our country, but what I would like to recognize too is just call the names of all the federal and state recognized tribes that we have in North Carolina. And this is a historical map of where our tribes were located. We have the federally recognized tribe of the Eastern Band of Cherokee. We had 7 state recognized tribes of Coharie, the Halawa-Saponi, the Lumbee, the Meherrin, the Okachinichi Band of the Saponi Nation, the Saponi tribe, and the Wakamosuans. So what do we know about, Robeson County? So Robeson County, as you know, is a large county. So one of the things I want to point out, and right now in 2020, we have a decreasing population in Robeson County that has been steadily decreasing since 2012. At the peak of the population, it was 135,000 people, a little more. Now we're at 132,000 people, with the sharp decline occurring after Hurricane Matthew, and then again after Hurricane Florence. And then so you realize that in a very short period of time, this part of the state was inundated not only with hurricanes, but ice storms and then COVID. And so we have had major housing issues that have resulted in people leaving our areas, particularly our African-American population. It seemed to have had a flight out of this area. Robeson County is almost 1,000 square miles, and our density of people is 139 people per square mile. The current census says that the racial breakdown of the Robeson County is 39.87% Native American, 27.98% white, Black is 23.82%, and we have a growing Hispanic or Latino of any race population right now that is standing at 4.2%. Excuse me, 4.3%. For some reason, things aren't wanting to work well together. So I want to just give you some things you probably already know about Robeson County, which is one of the reasons you chose it as an area to focus. So maybe not only the fact that we're one land. Now we used to say we're one land, 3 people. Now we're beginning to say we're one land, 4, 3 races and 4 cultural groups, very distinct cultural groups. Age. most people don't realize that their age dependency ratio is 6.64. And so, the wider the gap there, then it shows that for the working population, for the people who are earning funds, then you've got a large dependent population. So of a ratio, it shows then that we have probably 43% of our population is actually dependent upon the working population. The old age dependency ratio is only 24.5. And I say only because that's the opposite of what we see in the United States at this time. Our child dependency ratio is 41.9, which indicates that we have a fairly young population. That's coming from two different directions. One is our life expectancy is not as long. Our population does not live as long when we talk about life expectancy in a little while, but we also have a fairly substantial birth rate. Children in all of our cultural groups here are highly prized, and so we still have growing families. One of the other things you probably looked at is educational attainment of people over the age of 25. We have a poor educational attainment. With less than 9th grade, we still have almost 8% of our population. Less than 12th grade, we have 14%. So if you put those together, we have a substantial number of our population that have less than a 12th grade education, which is very impactful when we're talking about health literacy. High school graduates, we are at 33.4%. Some college, almost 10. Associate degrees of any kind, almost 10. Bachelor's degrees, 9.34, and then some graduate degrees, including the providers at our hospital systems and stuff, is only 4.36. That's discouraging to many of us, because when we talk a little bit later, we have a large university here in Robeson County. Robeson County, you'll hear me talk about the important things about it and things that we're building on, is that we have a community college, we have a good healthcare system, and we actually have a large university. Poverty is one of our biggest problems in Robeson County. I often tell people that if we could solve our poverty issue in Robeson County, we could teach the rest of the world in lots of ways on how to get along racially and respect each other's culture. So our poverty rate overall is 27.7%, which is extremely high. American Indian poverty rate is 27.7. Our African American poverty rate is 33.69. Hispanic is 42.47%, and with our white population having a poverty rate of 17.29. So you see, we have a very the cultural diversity in poverty is also something that we need to address. Part of it comes from the historical context. Part of it comes from the educational achievement. And part of it comes also with the fact that our white population does not have the same birth rate as our other populations in Robeson County. It's a lower birth rate. I think something that's very significant to me is the fact that our children, 70% of the children in Robeson County live in poverty. Okay. So some of the other things that I'm sure that you've already looked at or thought about as you were choosing Robeson, but I wanted to acknowledge is so how healthy is the Robeson population? I'm going to use the U.S. News and World Report data that came out just a couple of months ago, actually a month and a half ago, to give us a better snapshot of what's really going on. And I like this report. If you haven't used it in some of your work, it actually gives a different look than maybe we use with the census tract data to help us with that. So if I look at the overall health score, Robeson County our overall health score is 12 out of 100. For compared to population, the state is 41, and the United States is 48 out of 100, the score of 100. We are actually, Robeson County's peer group changed just recently. We are now considered an up and coming community. And so our peer group nationally, but yet having some of the up and coming peer group mainly is urban, because we have very few rural populations that are as diverse as Robeson. But we also are looking at some of the opportunities for our peer group to have educational access. And so that's how our peer group changed. But you will see, even with our peer group, looking at the diversity in most of these urban communities, their health score is 39 out of 100, where ours is still 12. So then if I look overall within population health, which tends to be my specialty and where I've worked most of my efforts in, even as a nurse practitioner, we're at 22 out of 100. And there's a variety of things that go into determining population health. One is life expectancy. If a child is born with the zip code of that's in Robeson County, it's that person can live as much as 9 years less than someone who is born in the Wake County, the Wake County zip code. Life expectancy for the county is 73.2 years, compared to the country at 77.5 years. And so one of the things that we are worried about, and I talked about earlier with the dependency index, is the fact that people are dying earlier in life. And so for our cultural groups, that's very discouraging and it has a lot of despair, particularly because of the Native group, because we look at what's happening with our elders. Our knowledge is leaving with our elders. Our culture is moving with our elders. And so we, as a cultural group, determined that there's different roles for different stages of life, and the elders are the ones who are the true keepers of the culture, who instruct us with their stories, who give us guidance as how we should move forward. And so the early death is a very discerning problem. One of the other things that we know is that a lot of our Hispanic population that bring very few elders, even though as a cultural group, they are also tend to be more focused on their elders. Our African-American group and our white population, they tend to have a larger migration out and don't return back to the county at the same rate that our Indian populations do after they have gone away for school. Health equity, and equity is an interesting topic. So I just wanted to give you some things, since this is an equity task force that goes into this study. So they look at segregation data, the segregation index, and segregation index for Robeson County is 0.646. The nationwide is 0.41. What that simply means is we are actually less integrated as a population than you would have expected with having the diversity of people. So I can take you through Robeson County. If you'd love to come visit, I would love to take you on a bus trip or just to a car trip, how many of you are on. And you can actually point out specifically the Native population. We tend to live in, as tribal communities, we tend to live in a more close geographic area of each other. And our society, while others are allowed to live there and not discouraged from living there, is that we tend to live next to each other. So that's one of the differences with the segregation index. The other thing that goes into equity is premature health disparity index score. And our premature health density index score is more than twice as high as that it is for the nation. So we have more premature deaths in the disparity than most communities in the country, and definitely more than most communities in North Carolina. So if I look as a scientist and as a researcher, what are we able to understand from sciences? Our premature death index is actually 4 times higher than it should be if we were able to apply all the things that we know from science. Education per capita, and I've specifically put some things on this slide for you to consider, is where our index is 30 out of 100. And one of the things that I think is particularly interesting is the difference in the expenditure per pupil compared to the state average of North Carolina. Robeson County, and I gave you the health educational attainment level already, spends $1,000 per student per year less than the state average. Compared to some of our richer communities, we spend $2,000 per year per student. The health expenditure is less than, actually $3,000 less than the national average of what's spent for students. So community vitality, you can see this is, we again have a very low score, and it looks at net migration. We already talked about the number of people that we've lost, particularly work was an issue that started in 2012. With that depression, then we actually have then hurricanes, and we lost a lot of our public housing, especially in the city of Lumberton and the city of Roland, which was areas that had large African-American populations. We have a very low voter participation rate. And I also wanted to let you know, we had a very low census rate, our participation rate in Robinson County, despite the efforts, because of the dates being moved at that time. The historical trauma in our community speaks of distrust of the government. And so if you think about what was happening with the 2020 census, and during the time we were doing the 2020 census, we had a lot of distrust of what was going on with our federal government and our state government, not only because of COVID, but also because of some other issues that were going on with, for instance, some of the George Floyd issues and stuff. And so people just chose not to participate in the census. Economic is again low. Our unemployment rate is 5.2 compared to 3.5. We have a higher percentage of our population who drive more than 100 miles daily to work. And then we also have the number of jobs that are available within a 50-mile radius is about 10,000 compared to the state of North Carolina, which is about 30,000. Our infrastructure is one of our higher scores, again, because we do have lots of roads, railroads, crossings, which also tend to have some other issues with deaths. But we do have a healthcare system that we talked about. UNC Southeastern is a 300-bed hospital. We have large home health care agencies that are owned by minority business owners mainly. And we also have, as we said, UNC Pembroke is a campus of about 8,000 students. And we have a community college in our system. So we're one of the few counties in the state of North Carolina that has both a four-year college that offers graduate studies, as well as a community college and a larger hospital. We are housing. We are suffering from housing, as we've discussed earlier. It became even more imperative for us to address housing and to address our overcrowding that we have. It's not unusual to hear of two families living in a single wide trailer here in Robinson County because they lost one of the trailers that they were living in during one of the hurricanes and haven't been able to replace it. And then again, a lot of our public housing was destroyed particularly in Florence. Environment, we have a fairly clean environment, but yet we also have a lot as a farming community, as you know, a lot of airborne hazards and hazards that relate to like crop dusting, some of those things that occur. One of the other things with the environment is our highways are considered a negative, even though they're positive in infrastructure, they're negative because of the amount of traffic that goes through our community. We have actually within a few yards of my office, we have a railroad that transports hazardous gas at least 3 times a day. Nutrition, food and nutrition, we've got a low score in nutrition because of the limited food outlets. As you may aware, people are not able to use their EBT cards if they go to the local farmers market most of the time. We have a lot of farmers who make produce and stuff, but then selling it to our poor population is a great issue. Public safety, the score is low there because we actually have very few paid professionals who actually give services. Most of our things in the rural community are provided. Our ambulance service, our firemen are provided by volunteer agencies. That's a great concern to those of us who are living in the Robinson County, because again, you may be aware of some of the issues we've had with trying to fight a pipeline that was supposed to basically go through our community. And I will tell you that I was one of the groups that fought the pipeline simply because we could not get the company to agree to pay for training of these volunteer firemen and volunteer rescue men, even though they would be the ones who would be responding. So our violent crime rate is high. obviously, and we have almost twice the national average of violent crime. And if you are aware, so violent crime is often Indian against Indian, Black against Black, white against white. It's very rare that it's across racial groups. But again, if you look at the housing index, the poverty index, there's just the stress that people are living in. So if I look at historical trauma and I look at the idea of TESD, it's estimated that a child who at age 5 in Robinson County has experienced as much PTSD as a soldier has on one tour in a battle zone. We have a high accidental death rate, again, more than twice I put the state average for you is where ours is 76.4. The accidental death rate for the state is at 55.2. And that's a lot of that's considered because of our issues with the highways and stuff. And then I just put the COVID vaccination rate because even despite all the efforts that we have, again, because of distrust, again, heard last night, I speak a couple times a week to community groups about COVID, about their distrust of the vaccine, about the distrust of the government. So it's 42.2%. I just want to just quickly show you this slide. I'm sure that you've all looked at this. This looks at our causes of death and which ones are the higher. So you see heart disease, cancer, tends to be one of our higher things. Stroke is definitely higher, and because we live in what's considered the stroke belt. Alzheimer's disease is higher, particularly in the Native population. And then diabetes is, again, much higher than we would see in other areas of the state. I just focus a lot here on this one, just some of the things I think that are significant for us and significant for me as a nurse practitioner, particularly. I look at our diabetes prevalence rate is 14.2%, compared to the state at 10.5. Again, it's higher both in our Native, Hispanic, and our African-American population, with our African-American population having the highest diabetes prevalence rate. Obesity is high. It's of grave concern because our obesity is not only in our elder population, in our adult population, rather, it's in our children and adolescent population. We have a high smoking percentage of our population in Robinson County continue to smoke. Again, smoking and oral tobacco use is extremely high in the Native American population. And then finally, our deaths due to overdoses is also considerably high compared to, and I put the racial breakdown for this one for you. You're seeing, then again, this is, remember, 2022 data. Our American Indian population our overdose death rates per 100,000 people is 8.3, our Black is 26, and our Caucasian is 61, compared to the state average of 29. And then access to care, just to, again, point some of the things that have been an issue for us is the fact that we, if I look at, we have a large percentage of our population that are insured only through Medicare and Medicaid. So Medicaid expansion or lack of it has really impacted us. Providers per population, we have a dearth of providers per population in every area compared to the state. And then also I wrote for you down the number of our households that still report having either owning a computer and having any access to high-speed internet, whether it was reliable or not, is still greatly impacting us, because we have a lot of people who say, well, let's just use telehealth to address the problems in rural North Carolina. And if I've got a population that's distrustful, that has a lot of cultural understanding and cultural trust, but then also they don't have access to one of the things that the state is looking at as being a big provider. However, that said, I am actually hyped about what Robinson County is moving forward and how we're moving forward. I think the best news is that we're resilient. Rural people tend to be resilient, self-relying, build their own communities anyway. But we are actually continuing to, despite historical trauma and our recent national disasters, we're beginning to grow. We are actually on a cusp. With a little help, I tell people we could really make some good leaps. We've had increased economic development. greater racial makeup of county leadership. So it's not unusual now that when I look at our county breakdown of leaders to see a racial divide. Not quite where we are as a population, but getting closer. That's really significant if you consider that in 1995, we actually had to sue the state. When I say we, I'm talking about the rural population in Robeson County sued the state and the county leadership to stop what we call double voting. It went to the Supreme Court of the United States because at that time, residents of who lived in urban cities or small urban communities that we did have were able to elect the school board for the county, even though their children didn't go there. They had a separate city school and county school, but they were allowed to vote in our elections and we were not allowed to vote in theirs. And so they controlled, even at that point, who was in our leadership of our schools. We have more diversity, greater diversity of job offerings than the state or nation or our peer group. We actually have a lot of collaboration of economic engines. When I specifically am looking at the community college, the university, we lost a lot of our industries with things moving with south and then again to China. Some of it's beginning to come back, but also the hospital. So looking at how are we collaborating, I am one of the major conveners of some collaborative groups with looking at how do we use all of our resources to drive economics. Our biggest business growth rate is greater again than the nation and in peers. And again, a lot of them being minority-owned businesses, one because of population, but also minority women-owned businesses. We have talked about that we have a hospital, community college, and university. We have expanding tribal housing and benefits to the tribal members and to the youth programs. Well, and so the reason that's significant is we raise these for a large percentage of the population, then that means some of the other things that are available for the county with limited resources can be diverted to some of the areas of need. We actually are considered having some of the most affordable housing in the state. Again, with American Indians have more so than other groups, but a lot of that's because we actually live in family areas. So our family may own some land, and then any family member comes bills on it, has houses. And so because we're also skilled artisans, we help each other build houses. So people may actually have a very beautiful house that they take 3 or 4 years to build because they use family and friends to help with the building process. We have increased numbers of participants who are applying for Medicaid and the CHIP enrollment. We have a larger percentage of our population in those programs. Again, we need, our applications are far exceeding our ability to meet those needs. And then our high school graduation rates have recently come to the state average. I will say our performance scores on standardized testing is still lagging behind. And then, so resilience, if we look at resilience, and when I use this model, when I'm working with the community, is emotional well-being. Do we have inner drive, future focus, relationships, and physical health? And so I look at then the cultural base for that is what is the definition of the care unit? Who is actually that needs to be talked about? So if I'm talking to a member of my white population, I may focus on individual or immediate family only. If I'm dealing with American Indian population, I need to do is extended family. Black population, I tend to ask. Hispanic population, again, is the family that they have created that may not be their blood family, but the family that they've created here in their community. Also, when and where do people want to be educated and want services? And so we normally look at where people normally gather. So it's not unusual for us to be in parades, to be at motorcycle bike runs, at racetracks, at giving healthcare services. So we look at also strategies. How do they want to learn? If we've got a population that's distrustful, then the person who delivers this message is critical. It needs to be someone who's role model or peer-to-peer is also important. But also we've learned that we use oral, written, and video at the same time. So I am doing a presentation tomorrow night, and I always give permission to the faith-based groups that I am to video it. We use our local radio stations quite a bit because, again, our religious radio stations have very distinct populations that listen to them, and we actually interact with those and reach out and offer to do programs. And the population is beginning to take us up on these significantly. So who delivers the message is extremely important. It needs to be someone who looks like them, who understands who they are, and acknowledges. So if I'm giving a presentation in Robinson County, the first thing I have to say is where I'm from, who my people are, and a little bit about why I'm actually there. And then we may have a period of silence, and then we would move forward, again, depending. And so I have all my faculty and staff and people who work with me on projects to understand one thing: we can only move at the speed of trust. It may require several attempts. It's not unusual for us to go somewhere the first time and have 1 or 2 people show up. The next time you go back, you build your relationship with people. So it's all about relationship building and moving at the speed of trust. And so what I did here just is to end, is just give you an example of some of the, some of the many networks that we are using here at UNC Pembroke, not only with the Lumbee tribe, but now other tribal communities here in the Southeast. Robeson County has a Healthy Robeson Collaborative that has actually more than 60 agencies that meet together monthly to try to discuss health. We have a mental health collaborative that includes the university, FQHCs, our hospital, and actually we've incorporated our district attorney and our drug court into that. We have community-based things that come up, such as an example as Stop the Pain, that arose from the community, and it's actually addressing addiction in our communities, and how do we actually realize that it's painful not only to the person who's experiencing it in the family, but it actually is a community pain. We have collaborations with CORE, which is a community-based organized relief effort, and who's came under our county starting in Hurricane Matthew, and we collaborate with them on national grants, HRSA grants particularly, to try to get services. We have just been named as the place that CORE is going to place all their supplies for natural disasters for the southeastern United States here in Robeson County. We have Healthy Blue. We realize that Blue Cross and Blue Shield and Healthy Blue, their foundation, has some efforts that we use and address. We have Healthy Start program, which is a federally funded the Department of Health and Human Services project to improve maternal and child health. We work with all of our faith-based groups, whether it's the Burnt Swamp Baptist Association, which is all the American Indian Baptist churches, at least in the eastern part of the state, and then, or the African American Ministers Association, which is a very large group here in Robeson County, and it gives us all good advice on what we're needing to do and work with. We work with our governmental agencies, whether it's the Lumbee Housing Authority, the Robeson Council of Government, or just the actually elected government officials. And then we actually recently joined the Southeast American Indian Cancer Health Equity Partnership, which our friend Ronnie Bell is a very important member of. And so then just some pictures. And I wanted to show you the pictures because one of them didn't come through right. We actually go out. It's how do we go out into the community and give services. So we've learned that something that people trust is the name of UNC Pembroke. And so we bring that out, and then, but we take, whether it's community workers, as you see in the lower left picture, actually doing things specifically designed for children, specifically designed for, disaster. And then we are actually introducing the community to the whole idea of an avatar. And so with this avatar, what I'm doing is being able to go out into the community and say, with a small group, and say, well, what's some problems in community? And we build the avatar to look like what they are, what they say their community looks like, and then they can determine their own risk factors. Then we take them inside and let them do their own personal avatar. And we are becoming a mobile lab so that people, when they have their own health history and their own information on a flash drive, and so that when they go someplace, they have that they can take with them. And I realized that was a longer presentation. I'm sorry, I didn't realize it was going to be quite so long.
No, it was perfect and informative. Thank you, Dr. Beasley. Um, it was so good to hear about the things that are happening in Robeson County. Sometimes we see statistics and we just look at them and they could be very dismal, but to see how you all have taken those statistics and put momentum behind them to bring change is very, very optimistic and very exciting to hear that word. I want to share with the group before we open up for Q&A that Robeson County has been selected as one of our counties of focus in the CDC work. So what we will be doing is we'll be having presentations from each county just to learn more. And hopefully, if they want to have us a part of their community to help build, we want to be a part if they will allow us to be a part. And as Dr. Beasley said, it happens at the speed of trust. And we are committed to moving that work forward. So what we will do now is we'll open it up for Q&A. I think there was a question, Dr. Beasley, from Change Agent Cooper. Do you have any certified peer support specialists in your area?
So yes, we have a few, but not nearly what we need. And so we're beginning to, again, trying to find funding so that we can not only train them, but also to provide them with some of the issues, some of the things that they would need for their work. And so the Native community has had the Lay Health Advisor model for a number of years, which we just have actually built upon. But we would love more help with that area because that is something. So one of the things, for instance, like we have a fatherhood project that we're doing right now with our Healthy Start, and we're training fathers of children who may or may not be in the same home with their children to be actively involved in their child's life. So that's an example, because research is very clear that if the father's involved, then the outcomes for that child, it's adverse childhood events, those things are much more impactful. And so the presence of the father, and to give them then the resources that they need and the training that they need. And so we actually are working with that, but that would be another opportunity that we would really reach out and desperately need in our county. Yeah. And again, for Change Agent, one of the things we've learned that is it's got to be within the cultural group of the people who need it. I go to African-American churches or white churches and speak, but I always take someone with the cultural group with me because they have a different cultural understanding than I have, even though I've lived and worked in Robeson County most of my 70 years. But it's still different. You have to, I speak and look through the world through the lens of my cultural group, as a rural Native American. I have to understand and be, so sometimes some of the nuances I may not pick up. So that's the other thing we're looking at with our peer groups is how do we develop them across the lifespan and also across the cultural group. So you may have many cells that we have to make sure that people are members of.
Right, great. Thank you. Are there any other questions or comments from our work group of participants? I know it was a lot of information, but it was good information as we move forward.
I have just a thought. Dr. Beasley, it was really, first off, just thank you so much for the amazing presentation. I think we all really are just inspired by the work that you're doing, the lens by which you do the work, and the real cultural appreciation that you have as you do the work. One of the things that really stuck out to me was the farmers market. So we know that there's a strong agricultural community there, and you would think that we would want to do whatever we can to incentivize folks to access those locally grown foods, but to know that EBT isn't accepted in terms of the farmers market is a real interesting challenge. And I just see there being so many benefits to that being different. So if folks were able to use EBT, the economic value that it will provide to the local growers, but then also the access to healthier and local food options. So my brain just started moving and thinking, because I know there are some counties that will allow, I think, EBT to be exchanged for tokens or different options that can then be used at the farmers market. But it could be helpful if we think about what models exist and then what the process might be for the county Department of Social Services or the state to really allow for that change to happen in Robeson County.
Yeah, and I think it's not that they can't, but so it has to be a farmer who's gone through all the application process. And so a lot of our smaller farmers who may grow food that they, will sell on the side of the road don't have, one, again, if I'm looking at the educational attainment, the means and the ability to figure out that or just do it. And so again, how we're trying, we use a lot of our CARES Act money here at the School of Nursing to purchase those two small mobile units. And we've had those units in blueberry patches, giving services. We've had, and first we've only had them for a year and a month now. So we've had to teach the community to trust them. And I learned very quickly I could go out someplace a day and no one would come. But then the next day, 10 people would come and they would say, my friend came yesterday and like we were doing vaccinations and got the vaccine, and you didn't talk down to him because he couldn't read. You didn't, but we trained everybody who went out to understand that. And so part of it is looking at how do we have to move. So if I'm going to ask farmers to do EBT certification, how do I help them? So can I take it out and help them do the application right there and get those done? And then you've got, again, a lot of paperwork, as you know, in doing that. So it's what would happen for a small farmer to be able to do that? And a lot of our farms and our farmers markets are small farms.
That context is so important, and that is the type of very granular work that has to happen. And I think and that's really one of the purposes of this work group, when we think about kind of decisions that are made at the state level, there's this desire or intent that they create the regulations and the processes, and then they just throw it out to the counties and it should just work. But there are some nuanced approaches that have to be taken in order to connect with those communities that ultimately need to access or benefit from those decisions. So thank you for actually clarifying that and helping me to understand that one particular issue better.
There's some conversation going on in the chat around community health workers between Change Agent Cooper and Shaughnessy. So we'll be glad to just connect via email post-meeting about that work. Shaughnessy, would you like to elaborate, or Change Agent Cooper about your comment?
And I think they gave me their email address. Well, Change Agent Cooper did, yeah.
Sure, I'll put my email address in the chat as well. But I just wanted to mention that I was actually one of the leads in the North Carolina Community Health Workers Initiative that is funded under Medicaid Managed Care. And within that, we have integrated, optimized, and mobilized community health workers within our clinics. We actually have a representative in the Robeson County area, and I mentioned her name, Paula. Yeah, so we can work together simultaneously to come up with whatever intervention is necessary and needed, and it's funded by Medicaid Managed Care, so it's a free service, so that we can integrate a community health worker or see if a community health worker is best fitting for the work that you all need in order to, bridge that gap between health equity and the actual community.
And I would like to connect Paula to our Healthy Robinson group, because I don't think she's in that.
Oh,
I wrote that name down because I think that's a significant thing. And then Miss Change Agent Cooper talked about, the whole idea of peer educators and peer mentors is critical.
And I would just add that if connecting with Shaughnessy would probably be best. I was gonna just educate you on the CHWs and the difference between those and peer supports, but Shaughnessy's connections would be the most appropriate ones for your area.
Okay, thank you. So I don't want you to leave this thinking all is doom and gloom for Robinson. I think that I was very pleased to hear that your group has selected us, because I think we're one of the groups that, with some help and with some dedicated agency, and with your group, would help us survive. We can actually begin to move this needle. As you know, with historical trauma and historical depression, of economics, educationally, health, it takes generations to really move that needle. So one of the things when you write a HRSA grant or something is, structure, process, and outcome using the Donna Beatty model. How do you really, what can you really show in a short-term goal? But a lot of things too, and I want you to understand as a group, is that building that trust and building those relationships. And however we can be a conduit to helping with that, we were definitely willing to do so. I will tell you, one of the things we've learned is, for instance, I partner here with our Spanish department here at UNC because we offer a degree in Spanish, and also our Hispanic students who are in school, and I don't want to burden those students with like, this is your group, because they're not ready for that yet. But then just for them just to go with me out and be with me and maybe say 2 words. So I had a young Hispanic student with me last night at a thing. And she said, oh, I'm only going to say 2 words, Dr. Beasley. I'm going to tell them my name. And I said, okay, whatever you feel comfortable sharing. And she's talked for 5 minutes. And it was such a joy for me to see that she felt like, and she's beginning. And so she's like, okay, can I ask you to go to another group with me? So that's the kind of thing that we slowly build on. But, I happen to have been, like I said, I'm 70. So I remember lots of times in my life, you wanted somebody to speak about Indians, call Cherry. Or, so some of that is building that network of people. So that's one of the things with the community workers, but also with us as we're developing healthcare professionals. I gave you the numbers of healthcare professionals, but then, again, we have got to have a plan of where we have healthcare professionals who are from communities.
Absolutely. Bridget, if I could just add, Dr. Beasley, we absolutely want to take you up on the offer to come down and to tour and just to go around and maybe even host just a community discussion with folks from the work group and community members. So I'll follow up with you offline, but I'll also stay in touch, Bridget and I, with the work group members. If you're interested, we may be able to support a bus while we're down there so that we can ride around and see just the physical community and talk to folks on the ground. So I thank you for extending that offer.
Oh, I will make sure that you see some very different things. Love the idea of a field trip, because until you can hear me talk about it, but then until you can envision it with your own eyes, and just the expansiveness of a county that's 1,000 square miles. Is so then I've got poor poverty. So I'm doing a research project that's coming out of Mount Sinai, and they said, we were talking about something, they said, Cherry, just give them an Uber pass. And I'm like, I don't have buses, I don't have Ubers. I mean, we're trying to figure out how to get people to clinic. But I do it.
Yeah.
So I love the idea of the Bernstein Fellows. Yeah. So the Bernstein Fellow, I think we just need to continue to work with all these things together. And I, again, know that I've taken more of your time than you initially allowed it on your agenda, but I so appreciate this opportunity.
And thank you again for accepting, Dr. Beasley. I'll leave it open for if anyone, just for last time, has any additional questions or comments, anything on your heart, your mind, besides the field trip, because I'm looking forward to that as well. Okay. Thank you again, Dr. Beasley, for your time today. I'll just, as a reference, just share our 5 additional counties so you all can see that. That we've selected. So here in the East, we have Robeson and Dublin. Piedmont area, we have Richmond County and Caswell. And then in the west, we have McDowell and Rutherford. Again, these are just the focus areas for this CDC work, and we do understand that and hope that our work can be replicated across multiple communities. We're all committed to health equity, and it looks different in every county, every community. So our hope is to have some best practices to be able to share, and also from the advocacy lens, be able to bring these recommendations up to a legislative arm to be able to advocate for our communities in this work.
And I appreciate the need for system changes. We greatly have to have system changes.
Absolutely. We've had our questions and general discussion. Member updates. Does anyone have anything to share about what's going on in your community in the next 30 days or 60 days that we can plan, or any flyers to share with amongst this group in your respective communities?
I have an event coming up. This is Kayla Taylor out in Halifax County at the Medoc Mountain State Park on April 30th. We'll be having a playground opening in the region, and we'll have a special tribal blessing from the Halawasaponi tribe there to come and bless the grounds and do a little drum, and it's really just an attempt to re-engage the local community with Medoc Mountain State Park, as opposed to it being, just a major tourist attraction. So we're really trying to re-engage the local community. And Miss Bridget, I can send you that flyer in a little while to share with the rest of the group. Thanks, y'all.
Perfect. Thank you. Any other announcements or things to share?
This is Philip. So there's a reentry conference held by the Division of Public Safety in Greensboro on April the 25th through the 27th. And so you'll be some best practices shared there for more so like the reentry services, lens, continuity of care, and what have you. Would be helpful information, especially for the rural areas, because people do return to those areas from prison. And there's also one community and recovery conference. I forget the exact dates on that off the top of my head, but if you're interested in learning about that, you can just hit me up in the chat, and I'll send over those dates for the one community and recovery conference, and that's in Colfax, North Carolina.
Thank you. And it looks as if Donna has posted in the chat that there is a mental health resource fair that will be happening on April the 30th in her area. Thank you for sharing. And we will, I think you also include the link. So what we'll do is compile these and put them in our note distribution to you all to be able to support or just share within your networks. Donald?
Yes. I was going to say, we have just one announcement. Our Bernstein Fellows program, which Bridget is an alum of, is now accepting applications for the next cohort. We'll share that information in the recap from this meeting. We'll send the flyer, but we would love for folks in this group, if you're interested in the support and training that's provided by the Bernstein Fellows program, that you should apply. And Bridget, if you have anything you want to add about the Bernstein Fellows program, and I know you could sell it better than I can.
Sure. So I was a Bernstein Fellow 2017 through 19. And it really was a career-changing experience, as well as personal. So many times the work is being done in community, but to be able to have that work raised up with state leaders and being able to be shared across the state is really great. It provides just some guidance, some connectivity to people that have been pioneers in the work, and been able to create lifelong relationships and connections. to this work. I think, just to know the story of Jim Bernstein and who he was and his footprint on the state and national level really gives us guidance as to why we're even doing this work. One of the principles was he believed in healthcare for everybody. Nobody should be exempt regardless of your zip code, the color of your skin, none of that. We all have a right to be able to be cared for and have a wellness and well-being. So, if you know anybody that's interested, please, encourage them to apply. If they want to talk to any of the Bernstein alumni, I'm sure they are all willing to have additional conversation. I am as well. I'm an advocate for the program, and look forward to seeing the new applicants in the upcoming cycle. And Carla has dropped the link in the chat as well.
Yes, Bridget, I just wanted to let folks know that a flyer has been put in your chat about our Bernstein program. And if you have any additional questions, please let me know. And we have a current class, Bernstein Fellows class member, Dania, is with us today. So we're happy to have you and proud of our Bernstein Fellows, past and present.
Absolutely. Well, I'll just leave it open for comments just one more time before we close. If no additional comments, our next meeting is May the 4th at 9 a.m. We will more than likely have one of the other counties present at that meeting just to learn more about these counties that we have selected and how we can support and collaborate with them in this move in health equity. So you get about 12 minutes back in your day. So have a wonderful day, enjoy this warm weather, and we will connect in a month. Bye.
All right, thank you so much, Bridget. Thank you, everybody, for joining us today. See ya.
Thank you, Bridget.
Thanks so much. Bye.
Thank you.